Yeah, thank you. I just recorded. Yes, everybody will record reviews. And make sure your name and professor's in the chat so that we can see that. Okay, we're gonna take a look at our PowerPoint. We're gonna start initially. So first thing we look at is gonna be, when we're looking at a community, what are some things that we look at to figure out what we know about them? We're gonna know like our health status, know what do people know? We're gonna look at our preventative health behaviors, like our playgrounds, our lights in the street. Are there street lights that are out? Are there driving programs for people in the community to learn how to drive? We will look at as well our importance of age-related concerns, and I do want you guys to know all of these. So what you're going to do is with your infants, you want to think about SIDS. You guys think about, when you think about SIDS, you're thinking about what our risk factors. So our smoking during pregnancy, overheating, those two warm blankets, and late or no prenatal care. Okay. When we're looking at kids, we're going to look at environmental things like common areas and playgrounds. What is going to put a child at risk? What are we going to make sure we are teaching about safety and seat belts and priority interventions? Those with chronic illnesses, we want to make sure that they have a medical home, and a medical home is going to be that place where all their information is kept together so that they can have it. We know that those with chronic illnesses, they're going to have many more appointments. They're going to need help making those appointments. When we look at our adolescents, we look at car safety is one of our big concerns because they're just learning to drive. There's another one, we look at violence among our adolescent population as well. And we think and worry about violence among our adolescents. In my class, we did a review on this week. We have our primary, secondary, tertiary preventions. So primary prevent, secondary we screen, and tertiary we treat. How does this come into play when planning for care of child diagnosed with a chronic condition? We're going to be worrying about chronic conditions such as with our secondary and our tertiary, a lot of them we're going to be treating already. When it comes to smoking, what are we going to do for primary prevention? What could we do for children and smoking? Does anybody have any idea? What could we do for primary? For smoking? Nobody?
Like a DARE program or something.
Excellent. Yep. We're going to educate in the school setting so that we're preventing them from wanting to smoke because of knowing what we do. And then tertiary, if a parent is a smoker, what do we know about vapes? There's something really important about vapes and kids. Anybody know? Vape oils can be poisonous to children. So be careful when you have that. And if somebody says, well, I just vape, it's not that bad, right? Public health, we know it focuses on disease prevention and health promotion. So that plays in part when we're doing our primary and secondary. With our Medicare and Medicaid, this was in a chapter about funding. So our Medicare is going to help our 65 and older. Our Medicaid is going to help those with the lower income levels and unable or disabled. We have two primary healthcare systems, private, which is going to be our primary care, and then we have our public, which is federally funded, and Medicare and Medicaid, okay? So that's how we break it down. The Affordable Care Act was passed, and it was passed by Barack Obama in order to help more Americans access health care. We wanted to increase Americans who could afford health care, increase our quality, and lower our costs. What do we know about the US? We spend more money on healthcare than anywhere in the world, but our indicators of health are not that great, meaning we spend all this money and we don't really get much out of it. We're not any healthier than anyone else. These I would like you to know about as well. The family FMLA, which is the Family and Medical Leave Act. Please remember that that's to provide job protection and health benefits for those who need to leave and take care of themselves or family. Care providers, caregivers may get unpaid care for family members, parents, children, grandchildren, and partners. We have our American Disabilities Act, and that's going to be passed in 1990, and that will protect us against discrimination to millions of Americans. And then we have QSEN, which is our Quality and Safety Education for Nurses. This is not a federally funded or federally moderated organization, but it does help with our quality improvement, our evidence-based practice, patient-centered care, and safety for us as nurses. We know our CDC is going to provide the most current guidelines for public health. Our World Health Organization is going to be our global health. And then we have the Institute of Medicine, which focuses on the development of policy that impacts overall public health. We had a whole chapter on evidence-based practice. We know that's use of current best evidence in making decisions about the care of individuals. When we look at which ones are our best, we're going to see that the best clinical trials are going to be randomized. And we're going to have our systemic reviews, which are going to be a combination of everybody's controlled trials. And when we have like that anecdotal and expert opinion, that's all the way down to the bottom. Okay, but we do know we do animal and cell studies, and we have case reports, cohort studies, random controlled trials, which are going to be abbreviated RCT. A vulnerable population is a group or subgroup of a population most likely to get something with their health. Why is that? Because of our social determinants of health. And those are risks such as environmental hazards, social hazards, personal behavior, and genetic makeup, right? So when we look at our health disparities, our largest impact is going to be economics. And we know they have higher chronic illness and less follow-up with our vulnerable populations. We take a look at their income and social status, their education, their physical environment, their social support, their genetics, their health services, and gender. Men and women, we know, suffer from different types of disease processes at different ages, so something to keep an eye on. How do we prevent in our vulnerable populations? Here's some examples. Our primary prevention, we're going to give those flu vaccines. We're going to do screening clinics, like nurses who work in homeless shelters, prisons, migrant and treatment facilities know that those who are at high risk for communicable diseases. TB screening is a big one we see in the prisons. And screening homeless adults and those who test positive. And then we're going to have our tertiary prevention, which is going to be conducting a therapy group for our mentally ill adults. All right, we take a look at our primary goal of public health. We do know it is the prevention of disease and disability. We know that we are going to see with primary and public health nursing, there's a lot of autonomy and independence. We have a population-focused practice. We look to identify programs based on gender, age, and race. And we want to make sure our clinical practice is going to focus on individuals. So public health policies, leading course of mortality has shifted to chronic diseases, and our increase in the number of older adults and population has created a challenge for us as public health nurses. Population of the world is increasing due to increased fertility, decreased mortality. People are living longer, vaccines, screening tools, meds, health disparities. We know our largest impact is going to be our economics, higher chronic disease, and less follow-up with our vulnerable populations. So I'm going to emphasize again why work in public health. Autonomy is the head of its practice. You have a lot of independence. Remember, with our frontier nursing service, that's when we had in our history chapter, and they really focused on immunizations. We look at our objective, Healthy People 2030, to change to increase health equity and social determinants of health, set national goals, live lives that are free of injury, disease, lower or get away from our health disparities, our money, or education, things like that. We did 3 chapters on family, so please understand that family has no right model. Each family is unique and we need to be considerate and patient to whatever is what is. There is uh, a box in your book in chapter 20, characteristics versus healthy versus unhealthy, functional versus dysfunctional. I want you to think about your delegation to non-nursing faculty and how we would use that with family. Know that a crisis is going to occur when the family is not able to cope with an event and becomes disorganized or dysfunctional. They'll oftentimes say, I can't do this. When we look at families, we look at genomes, which gives our providers their genetic information. And then we have our eco maps, and that's where they look at the families and their social units, church, school, work, clubs, and interactions with others in the community. We're gonna have some information about smoking. What do we teach our parents about smoking? We talked about that with vaping, secondhand smoke, asthmatic patients. We know that we're gonna be making sure that they are educated that smoking should not be around them. When we look at our duties of a school nurse, we do our roles in vaccines, we teach primary, secondary, and tertiary prevention with things like lice, obesity. If I have a student come into the office, I'm going to remind myself of ADPI, and someone can't breathe, that's going to be a priority over a rash or anything else, right? ABC is going to trump. So in schools, interventions are aimed at preventing violence from occurring, such as engaging parents in activities, getting communication, problem solving, monitoring of children, supporting assistant, zero tolerance for weapons, that kind of school nursing. Know that we will treat emergencies as needed. And injury prevention, we're going to do obesity and nicotine with our teens. These are 2 concepts that we need to know very, very well for the test. Community oriented, we're going to focus on giving service to individuals rather than on just a community. So like our example is going to be developmental screening tests for kids in a Head Start program. And then we have community based, which is going to be our health promotion and disease prevention. So we're going to look at those kids in the Head Start program and see if we're having any chronic conditions. Can whoever just join mute, please? Hold on.
It's really good, right?
Okay. Let's see, community-oriented based. Primary focus of community-oriented nursing is on the healthcare of individuals. A nurse who is demonstrating community-oriented nursing will evaluate the risks of individuals, families, and groups. There is on your study guide, and you should know this a little bit. Difference between advocacy and social justice is in one of your chapters. And advocacy is going to refer to actions taken on behalf of another. And social justice is going to be equality. So the heart of social justice is justice with respect to the treatment of more advantage versus less advantage. So we're trying to treat everyone equally there. So one is speaking or helping on behalf of another, and one is working with equality among our populations. Leading cause, I'm repeating this, so please know this. Leading cause of mortality is shifted to chronic diseases. Increase in number of older adults and increasing population has created a challenge for the public nurse. And we know that our increased fertility rates and older adults are creating concerns for our public health nurses. Primary goal is prevention of disease and disability. We know that we work to understand problems and treatment of individuals. When we're looking at going to the home, why are home visits the best? Because it identifies what's going on and we can really learn a lot. How does a community nurse overcome barriers? Assessment needs to be interactive. Don't disclose too much early on. slow it down, take time to build some trust, establish the environment. Before the assessment, review why you're going, preferred time, purpose, and try to have the whole family there. We take a look at our home visit safety as nurses. We leave a schedule at the office. Plan the visit during a safe time of day, dress appropriately, don't go secluded places, check in with your office, be aware who's in the house or apartment, ask if you have allergies, about pets, keep yourself safe, and pay attention to what you put on social media. Quickly looking at guns and safety, we worry about with the young kids, guns and safety. Storage and safety, gun control legislation, make sure that we're not mixing anything with our gun, having guns in the home, because that may cause some more trouble. Drugs and alcohol, do they talk about that? What do we need to teach as nurses? No, please, that isn't our patient rights. We see elder having a lot of abuse, and we know that unless the patient is declared incompetent, the patient should be able to have the right to self-determine finances. So don't let a child take over an older's finances if they can do it them own. We're going to work with our elder population to maximize self-care, manage chronic illness, prevent complications, achieve highest quality of life. Primary focus of community-based nursing, we spoke about this a little earlier, is on ill care and chronic illness, and community-oriented is on our health care of individuals. Ethics. Know that we really need to understand our ethics before we start in this profession. We deal with moral dilemmas, and our Nurse Practice Act is going to be the one that tells us what we can do from state to state. And that brings us to the end of my PowerPoint. I covered the content that I need you to know for your test. What questions do you guys have for me? On the study guide or in your head or anything?
Can I have the PowerPoint sent to me?
No, you cannot. The PowerPoint is not shared with any student.
Can you go over the last slide again? I'm sorry.
Yeah, no worries. Last slide about ethics.
Yes, please.
Yeah, so I just want you to know, as a nurse, we need to know where we stand ethically and what we believe in ethically, and where there might be some violations on that. And so we need to really follow our Nurse Practice Act. That gives us our guidance.
Thank you.
Sure.
Are we going to able to have a link to rewatch this review?
Yes, it is
Okay.
recorded. Yep,
Thank you.
yep.
Is it going to be available for all classes or just yours?
Nope, everybody. I will send it after it's done recording this evening. What I will do is I will send it to all faculty, and then they will post it to
Okay,
their
I was
classes.
wondering if you can like give further like examples and explanation on the community-based nursing.
Yeah, just give me 1 second. What I'm going to tell you about community-based and community-oriented that I want you guys to really know is definitional, what the difference is. So one's illness and one's wellness. And that's sort of just what I want you guys to know on that. I gave you an example in the PowerPoint, and I'll go over that again. Just give me 1 second, I'm looking for something. Any other questions while I'm looking for what I'm looking for? Multiple choice, 5 math, so please make sure you review your math. Your math so that you know. So you get those 10 points, because that's an easy 10 points to get, you know? You guys know your math.
Are you able to review some math with us?
Yeah, let me take a look at something, and that's what I'm pulling up to see what math I want you guys to know.
While you're doing that, do you know if there's going to be any of those I don't know. I don't know what the word would be to describe it. It's where it asks you to select what's pertinent and it gives you like a list of things and you have to drag and drop it to the
No,
other.
Those
no,
are the
it'll
words.
all be multiple choice. But what I will tell you is that there will be select all that apply.
Okay. Yeah.
So
I
that's
remember.
where you pick multiple answers. You know what I mean?
Yeah. I just remembered last time that we had a couple questions like that somewhere.
No. Let me see here.
I'm sorry to interrupt, but what time did you start this review?
I started at 8 p.m.
Are you in Eastern time zone?
Well, no, I'm on Mountain Standard Time, but it's
Okay.
8 Eastern Standard Time. That's
Oh,
what time it was to begin.
okay. I don't know why. Okay, thanks.
You're welcome. I'm just looking here at the math to see what math we have. Alrighty, so for our math. We're gonna do IV conversion. Like you get so much and you have to give so much, you gotta convert, like it comes like in, 200 units per 1 ml, and you have to give, this isn't the question, but I'm like making it up as we go, but it's like, it comes in 200 mLs per 200 units per 1 ml, and you have to give 600 units. How many mLs would you give? Does that make sense to everybody? So if you have 201, you'd have to give 3 to get to 600. So there's a question like that. There's a question about infusion rate. So if I have to give so much over a certain amount of time, you know how you guys figure out your infusion rate? Drops per minute, that thing. And then let me see. Yeah, and then another conversion of like, this is how it comes, and this is how much you have to give. So those are about your math ones. So there is I know I posted in my announcements a math like a practice thingy. Did everybody get that in their announcements? I know my 2 classes did, but I didn't know if the other professors posted it. So if they didn't, just ask them, they will post it too. They have the same thing I have. Any questions?
Yes, I have a question. I'm trying to
Mhm.
email my professor, but for some odd reason it doesn't come up when I pull the contacts for this class. Is it under all online teachers?
Who's your professor?
I believe it's Professor Morris.
She's new this quarter, so I can put her email in the chat if you want.
Yeah, please.
I don't think it's Morris though. It's like hyphenated.
Yeah,
It's hyphenated, right?
yeah.
All right, hold on, I'll find it.
Thank you.
Sure. Any other questions?
Yeah, I had the question on the community-based versus community-oriented.
Yeah, and you wanted a hold on a sec. Is your teacher is Harrison or is it Morton? Those are your 2 choices. Morton, Ford, Marvel, Price, Harrison, Howard, Kershaw, or me, or Lundy.
I apologize. It's Colleen Price.
Oh, Price. All right, 1 second. It's colleen.price@fortiscollege.edu. COLLEEN.price. And the question about community-based, community-oriented, tell me that again. You want another example?
Yeah, like I know you said one is like one is illness and one is focusing on like prevention, I believe. So I guess when I was reading the example, it seemed like one was focusing more so like a program that included a lot of children versus like individually screening. Was I reading that correct?
Yeah, pretty much. Oriented nursing is going to evaluate our risks of individuals, families, and groups, where community oriented is really looking at our healthcare, you know. So more the healthcare to an individual. Any other questions on that? Let's see. You have some questions on, yeah, there's 2 questions that you'll see on community-based and community-oriented nursing. So know those 2 concepts there. What else can I do for you guys? This one went really quick. My reviews are not usually this fast. I don't know why. Maybe I went through the PowerPoint too quickly. You guys have your study guides. Focus on your study guides. That's going to be important. Select all that apply. Just
And the
please
study
read
guides,
them.
are they the ones that were emailed?
Yeah, it's like 6 pages, the study guide.
Okay, thank you.
As you know, you guys are reading, preparing, doing all the PowerPoints, all the assignments, but we do try to focus you for the exams. If that makes sense.
Yeah.
Mhm. It's a lot of content, and I know that, and we've only been in class 2 weeks. I feel your pain, I know, it's a lot. So what I want you guys to do is study this week. What I want you guys to do is listen to the recordings. You will hear the same things repeated over and over in recordings. Okay, so when you hear those things repeated, it's usually a good idea to commit those to memory. Please make sure you have your name and your professor in the chat so that I can copy that, and that is our attendance. Do I have anything else? You guys have no questions on anything? No. I know this has been a long night for some of us because we've been in class for 16 hours and now we're sitting here. So I appreciate your patience. And if you guys have any questions, please reach out to me. My name is Jennifer Aloni and I am available on the Fortis site. If you have any questions, I will be posting this recording, like I said, to your professors. So have a good night to everyone. Stay safe and healthy. And any questions, send me a note. Take
Thank
care.
you.
You're welcome.
Thank you.
You're welcome.
Good night. Thank you, Professor Lonnie.
Good night.
Thank you.
Thank you.
You're welcome.